Hello, I'm Wendell Ray, and welcome to UWO Now. We're glad to have you join us for another conversation with a member of our UWO community. Each year, the University of Wisconsin-Oshkosh recognizes outstanding alumni for achievement in their careers and their civic involvement. The Alumni Awards Banquet will be Friday, October 18th, part of homecoming weekend festivities and events. For information, contact the University of Wisconsin-Oshkosh Alumni Relations Office. Dr. Aaron Robinson is one of our outstanding Young Alumni Award recipients this year. He joins us from his home in Minneapolis. Good to meet you and glad to have you with us today.
Well, thank you very much. Happy to be here.
So you are now a practicing physician in Minneapolis. Tell us, first of all, where you're from and how you got to UWO.
Yeah, so my family is actually initially from the Menominee Indian tribe of Wisconsin. So that's up near Shawano, more close to Kashina, which is about, say, a couple hours northwest of Oshkosh. But I spent most of my time growing up in a tiny little town called Winneconne, Wisconsin, which is actually pretty close to Oshkosh. It's about 15, 20 minutes away, just up 45. So, man, this has been a long time ago now. I graduated high school in 2008 and graduated UW Oshkosh in 2012. So I initially went to UW Oshkosh after spending a little bit of time at UW-Madison and then deciding to come back to Oshkosh and took my ventures after that to medical school, back to Madison actually at UW, and did that for 4 years from starting in 2012. Took a little bit of a detour to get a master's of public health degree, which kind of interested me in a lot of stuff with stuff going on in Minneapolis and more so in emergency medicine. And then finished up medical school and did residency at Hennepin County Medical Center in Minneapolis from 2017 to 2020. And then finally did EMS fellowship, which focuses on medical direction for EMS services and paramedics and the such. Did that at HCMC as well with Hennepin EMS and finished that in 2021. Since then, I ended up loving Hennepin so much that I stayed around and got hired on as faculty and been here ever since. It's been 7 years now.
Tell me why you chose UWO.
So UWO, at the time, I came from a really small town, and I think our graduating class was around 120 people. Going from that to a really big city, really big system, I think was initially in my goal. But going from the jump at the time when I was 18 and had no idea what I was doing with my life, you felt a lot more like a number in a big system. Mm-hmm. And while that was fine, I really wanted a more personal approach at that time in my life. So I ended up coming back to UW Oshkosh after my freshman year and finished out my studies at UWO. That's where I met Dr. Dana Merriman, née Dana Vaughn, and she was really helped guide me through college and through the journey. And I did not feel like a number anymore, and the class sizes were a lot more what I was used to and found I could succeed with, just like labs and everything else. And UW Oshkosh, I felt really prepared me for the studies of medical school. Also had a lot of great mentors that have gone through the system before and become doctors as well from UWO.
And tell, why were you interested, or how did you become interested in pursuing a degree or becoming a medical professional, I guess I should ask?
My mom's a nurse. She was a nurse at Winnebago County Mental Health for a very long time. And my uncle was a doc down at UW-Madison, actually. So I've been around medical people for most of my life. It was the only thing really that I saw myself doing. I love doing computing and audiovisual stuff as well. But at the end of the day, and I explored different areas, at the end of the day, medicine always drew me back. I enjoy working with people. I enjoy being able to teach residents, and just kind of always felt myself getting drawn back to medicine.
And you practice, you mentioned emergency medicine. Let our audience know what's that distinction? What are we covering when we're talking about emergency medicine, and what is the preparation? How is it different than any other type of medicine that someone might practice?
Yeah, so emergency medicine at its core, and basically saying is I'm preparing myself to work in an emergency room. So emergency medicine has been a specialty now for a few decades. It initially wasn't, just like every other specialty, but it's one of the younger specialties. It's actually now one of the most popular residencies that you can go into because of the variation of what you get, the procedural skills, as well as the lifestyle. It's shift work essentially. So while the hours may vary, you're not taking as much work home with you as you would if you worked in the clinic, for example, or on the inpatient ward. So at its core, we deal with every patient that comes in undifferentiated. And that comes from I stubbed my toe to I'm having a stroke to I got shot in the chest. So that wide breadth gets us exposed to a lot of different patients, and we have to know how to stabilize and triage them to get them to their next level of care.
Now, you're making that seem a lot simpler than it is. I know my wife is in the healthcare industry as well and works in those emergency settings. And you have to make some split decisions sometimes to analyze what's going on, be able to determine what's happening with someone who's in the emergency room. So it's it's pretty fast paced, and decisions have to be made in a split second, and you got to be right. Tell us about what that is like. What is the day to day life like for an emergency room physician and that team?
The day to day life is super variable, and I love it, and that's why I went into it. I very much would dread a normal 9 to 5. Just repetitive and doing the same thing over and over, that didn't really appeal to me. And some people love that stability, and that, like, I'm knowing what I'm doing Monday through Friday. That wasn't for me. I like walking into work and having absolutely no idea what kind of day it's going to be. Is it going to be super boring, or am I going to just get my butt kicked? So yeah, you have I'm a doer, and emergency medicine attracts a lot of folks that are doers and kind of wide range of personalities, but I like to make decisions with not a lot of information, and that's what you have to do as an emergency medicine doctor. We don't have minutes or hours or days to gather as much information as we can to make a decision. We have to make a decision and triage patients based on the available information at the time. That's what really draws me to the field, and work with a great team of folks, different mentors and colleagues that do a great job at it. So
You mentioned one thing that maybe kind of went past our audience. And, I think when many people think about an emergency room setting, Dr. Robinson, they may think, okay, somebody had a heart attack, somebody had a broken leg, somebody's not feeling well all of a sudden. But a lot of people, many Americans, for whatever reason, typically because of healthcare issues, I'm talking about the expense side, use emergency rooms as their primary opportunity to see a physician. That's the only time they see a doctor so they use coming to the emergency room as kind of a visit. Is that something that you guys in the medical profession are talking about, and ways to address that, to get to see, as you said, to see folks before it becomes an emergency?
every day, and we talk about it all the time. We work collaboratively with our clinics and our clinic staff for during the day issues. When a person comes over here and I'm like, hey, this could probably be seen in clinic. Let's call the clinic and get you in over there. In a big system, that can be hard, but our clinic staff has been really helpful and supportive with getting folks that could be better seen in a clinic setting over there. Because me as the ER doc, I never want to see you again. If I see you again, something bad happened.
Yeah.
We want to have you establish care with a clinic physician so they can better help coordinate your care. So that is overcrowding in the emergency department, and everything has been a problem for a long time, but COVID has made it drastically worse. I went through residency and my third year pretty much right in the heart of the COVID pandemic. So it's been a very big change.
Wow. Welcome to the club, I guess, was when COVID hit. You were experiencing some things that I guess many of your seasoned colleagues had not experienced, or at least not on a regular basis. What was that like for a new physician? Were you also in your residency at this time? But what was that period like for you?
Yeah, it was 4 months before I graduated when COVID first hit Minneapolis. So I was finishing up residency at the time. It was just a lot of unknowns. We didn't know how severe the disease was going to be initially. We didn't know what the mortality rate was. We didn't have a treatment for it. We didn't really know anything. And um, we had an idea. We knew it was a respiratory illness and knew everything else about that type of coronavirus. But is the mortality thing aside, like getting sick would put you out for 2 weeks. And when you're in residency and there's 12 people in your residency class, if we lose one person and all of a sudden they get two other people sick and they've got to go out, now all of a sudden it's like, oh man, there's only 8 of us now to fill a schedule that 12 usually do. So that became a little bit of an issue when people would get sick from it or get exposed to it at work. Um, but it was a lot. People would come in completely asymptomatic just because they got exposed, and that would bog us down. Then people would come in and they've got the classic viral symptoms, but they can go home. And then people would come in and have O2 stats in the 40s and either die or wind up on cardiopulmonary bypass. I mean, on ECMO. So it it was a wide range. I mean, we saw everything. It was, unfortunately, it got super politicized, but it was a real thing. I mean, this was not like the common cold. Like it was worse than that. But honestly, the biggest effect have been the after effects of it. So people got burned out, people quit, people went to other jobs, and we are not playing with the same roster as we did 4 or 5 years ago. So a lot of people have left. There's a lot of new people coming in, but there's not enough new people coming in. So every hospital, every EMS service, every healthcare area is short.
So you're in emergency medicine and very involved in also not just treating, but also preparing. You're an instructor, so you're preparing a new generation for the work that you do. What's it like being an instructor? Having been instructor, been in the classroom, what made you want to go kind of start being on the other side, so to speak?
Man, it's great. We work with some of the best residents and some of the most motivated folks out there at HCMC in the emergency department and the rest of the hospital. We house multiple different residencies in almost every specialty. So the hospital is essentially run by residents and learners. So it's awesome. Seeing folks succeed, and when they first come in as interns, and we just welcomed another batch of interns last Monday, so everybody's starting fresh, and just seeing the progress they make, even in just a year, is really remarkable. Everybody's very nervous to take that step up to second year, and then they take a step back and they see the big picture and they realize how far they've come just in a short year. So helping folks succeed and teaching people things that hopefully they'll take with the rest of their careers, and showing them one way to do it has been a great area of pride in my career.
You also are doing some work in the NFL. Is that correct?
Yeah. So the NFL works with a ton of different physicians, and of course, there's the team physicians, the orthopedic doctors, the internists and stuff that take care of the players on a day-to-day basis, or might follow them for injuries or stuff like that. So HCMC is actually across the street from US Bank Stadium in Minneapolis, where the Vikings play.
Okay.
And so our emergency medicine program. So there's 4 of us that do it. We serve as what's called the emergency response physician. So the NFL is, incredibly, you don't hear a lot about this from, the glitz and the glamour of course, big touchdowns and scoring long drives and everything. But behind it, there's actually a big safety net. And with all the stuff that we hear about CTE and traumatic brain injury and everything else with the NFL is actually pouring a ton of resources and money into researching it and preventing it and how do we treat it. So at any given game, there are multiple different physicians in addition to the team physicians. So there are neurological consultants who only job is to watch for concussion type symptoms and pulling that player out of the game to safety. There's a handful of them both up in the booth and down on the field. And then there's a couple other physicians, one for managing the patient's airway if that needs to happen. And then so there's an emergency response physician, which we do. That would be worst case scenario. If I get activated on game day, that somebody's having a bad day, unfortunately. So we would be in charge of if a player goes down, and the medical team has to come onto the field, and we're in charge of running that resuscitation and running that code if that were to happen, and then getting them to the hospital.
So we're talking about not your routine injury. We're talking about something that is a serious medical issue that would require some resuscitation. Is that what I'm hearing you say?
Right. So, most recent example is DeMar Hamlin. So Buffalo Bills suffered a cardiac arrest on the field. Something of that nature, where a player has to leave the field. Spinal cord injuries or spinal cord potential neurologic deficits, big stuff like that. Going to the tent, that kind of stuff. That all goes with the athletic trainers and the team physician.
Okay. So have you been active? Have you had to have some situations where you've been on the field to help an injured player?
Nothing major, knock on wood, in my few years doing it.
Hello, I'm Wendell Ray, and welcome to UWO Now. We're glad you've joined us for another discussion with a member of our UWO community. Each year, the University of Wisconsin-Oshkosh recognizes outstanding alumni for achievement in their careers and their civic involvement. The Alumni Awards Banquet will be Friday, October 18th, part of homecoming weekend festivities and events here on campus. For more information, contact the University of Wisconsin-Oshkosh Alumni Relations Office. Blair Braun is one of this year's outstanding Young Alumni Award recipients, and she's in studio with us today. Thanks so much for coming by and talking to us today, Blair.
Yeah, thanks for having me. I'm excited to be here.
You had an education experience here that many may be able to relate to. Things didn't get off on the right foot, or may had some struggles that first year. Tell us about how you got to UWO and about that first year here.
Yeah, so I started at UWO in spring of 2013. My first year, I went to Concordia, University of Wisconsin. I wanted to play soccer. Soccer was my life. I went there, had no idea what I wanted to do. Mm-hmm. I started out as a pre-pharmacy major.
Okay.
When I came to Oshkosh, I changed my major to business, thought I wanted to do business, and it just really wasn't for me. I didn't know what I wanted to do. I think a lot of the college students kind of can relate to that, where they don't know what they want to do right away. They're in a bunch of general education classes. And I ended up taking a couple years off. Came back fall 2015 and really enjoyed being in a general psychology course. And that kind of just took me to where I am now. I graduated in spring of 2018. And yeah, my time at Oshkosh started off weird, but turned out to be okay.
So what was it about that psych class, or those psych classes that you took that said, okay, this is it?
Yeah, I think I really just started thinking about thinking more, and the complex underpinnings of everyday thought was so cool to me. Thinking about how memory works, how working memory works, how attention works was just really fascinating. And then that is now what I teach.
Okay. Eyewitness suggestibility.
Yes.
I think I know what that is just from the phrase, but define what that is and how impactful that really can be.
Yeah. So essentially what eyewitness suggestibility is that eyewitnesses are prone to developing memories for things that are merely suggested to them. In the typical paradigm that we use to study suggestibility, participants see an event. Later, they're exposed to some misleading detail about the event. And then what we do at the final test is ask them, hey, do you remember seeing what we told you happened? That piece of misinformation. And it turns out people are really prone to developing confidently held false memories, so a memory of something that never happened for events that were merely suggested to them.
Is there any evidence as to why that's happening?
That's a good question, and that's what I'm hoping my program of research can disentangle.
Okay.
This is a newer area of research. A lot of the research in eyewitness suggestibility has looked at factors that happen in coding when you're putting the misinformation into memory. What we're looking at is retrieval, what happens when you're asked to pull it out of memory. And there's not a lot of research about that yet. And our multifaceted questions show that having those complex questions with complex syntax decreases accuracy. So now we're kind of trying to disentangle why.
So even the type of question that is asked, if it's a compound, complex sentence with a lot of commas and colons, can make it more difficult for someone to recall something accurately?
Correct.
Wow. Okay. Man. So you have made some distinctions in what you are interested in research, and they sound similar to me, but help me to put these into categories.
Mm-hmm.
What's the difference between false memory and eyewitness suggestibility? Is it suggestibility is when you're inserting something to throw them off, or what? What's the distinctions there?
I would say that you can study false memory in other areas other than just eyewitness suggestibility, right? So false memory for childhood event. There's different aspects of false memory that I'm interested in. Eyewitness suggestibility kind of just falls under that umbrella.
We're talking today with UWO graduate Blair Brown. What does it mean to you to get this recognition from UWO, Blair?
It's really exciting, and I haven't even thought about that yet. My time at Oshkosh, I loved being involved in campus. I loved doing research and tutoring and all of the things that I did while I was here. I was an orientation leader, and then to get this honor back from UW Oshkosh as a young alumni means a lot for me. I don't know. I am really excited to be an alumni from this institution because of the faculty that helped me get to where I am today. And I'm really proud to be an alumni from Oshkosh.
So you mentioned earlier that you took some time off. You came here, had to kind of recognize that maybe you weren't sure what it is that you wanted to study. Came back, though. Mm-hmm. So why did you come back? And then also, after you tell us why you came back, what was Blair 2.0, so to speak, like as compared to when Blair first came here to UWO?
Yeah. So I came back because I thought I wanted to be a teacher.
Okay, so that's career 3?
That's career 3.
Okay.
We're on career number 3. And I am a teacher of some sort.
You're right. That's correct. Yes, you are a teacher.
I am a teacher. But yeah, I came back. I thought I wanted to do teaching, but I took that psychology class and just changed completely what I wanted to do. I wanted to really dive into psychology more. But Blair 2.0 was super serious about her education. Okay. I studied all the time. I think part of what I was missing when I first went to school was that I engulfed myself in one community, and that was it. And that community was sports. And sports are great, but my life was soccer. It wasn't school and soccer. It was like, how can I be the best soccer player that I can be? But I came back, I was like, okay, how can I be the best student I can be? And I studied a lot. I was involved in Psych-Chi, in Psych Club. I volunteered in the Oshkosh community. And I felt I built a bigger sense of community here on campus. And that was helpful because I had resources. I had more friends that I could go to and talk about what we were learning. Some of my best friends today, shout out to Jess, who is at Boston University, also pursuing a psychology PhD.
So it sounds to me like you channeled the energy that used to be focused on soccer into academics.
Yeah.
And you stepped up your game, so to speak. And also, as you mentioned earlier, became involved in a lot of research while you were here. How did that influence your academic career?
Yeah, I was involved in 2 labs, heavily involved in both of them, probably doing like 20 hours a week per lab. I was taking independent studies to do research. I was in Psychology 480, which is the advanced research in psychology class, with 2 different faculty members. And that really contributed to what I wanted to do. I've been doing the research on false memory that we've talked about now for 7 years. Okay. That's what I went on to do graduate school for. Now, I did have to decide between doing false memory research and child development research. I really liked learning about how kiddos learn language. I actually won a grant through the Office of Student Research and Creative Activities to do that research here. And it was really exciting. I just liked eyewitness memory a little bit better. Both of them were within cognitive psychology, though. So I had to pick which one I wanted to do, and I decided to do the eyewitness suggestibility route.
Okay, eyewitness memory, eyewitness suggestibility, false memory, all that is really interesting stuff and can play a role in someone's freedom if they're on trial. So the question is, have you or any of your colleagues ever been called to testify about eyewitness memory or suggestibility?
Yeah, I haven't yet, but I have had colleagues that have been asked to serve as an expert witness. And I actually got to see the effects of what I want. When I was still an undergrad here, I was interested in going to law school as well.
Okay.
So in the summer between my junior and senior year, I interned at the University of Wisconsin Law School through the Innocence Project. Or the Wisconsin Innocence Project, right? The Innocence Project seeks to exonerate those who believe they are wrongfully convicted through DNA evidence. And I got to see, like, reading different court transcripts, the different types of questions lawyers were asking, things that the psychological research that we do in a lab applied into the legal setting.
So were you were seeing stuff, I guess. You were saying, oh, look at that. Well, no wonder they answered that question differently. Listen to how the question was rephrased or asked in a different way. So you were finding a lot of gotchas, I guess.
Yeah. And I mean, lawyers have the opportunity to object to a question, right? But I think an area of research that I'd like to be a little bit more well-versed in is how do jurors then recall that objection? Are they actually able to put that out?
Oh, really? So
I don't know much about that yet. That is a goal of...
But it's interesting.
Yeah, it's an interesting question.
And that's something I've always wondered. So how do jurors react to what is going on with, all the different proceedings within a trial, one, and also when a judge says, you didn't hear that. Okay. How does that play into, did they really not hear that, or does it sway them in one way or another? And I guess that's just another area of study for you.
Yep, it is. And that's something that I'm hoping to pursue in my career at Platteville.
Wow, that's fantastic. Well, thank you so much, Blair, for coming by and talking to us today. It's been really interesting to hear what you've been doing, and congratulations on your award and recognition from UWO. I think you're well-deserving, but thanks again for coming by and talking to us. It's been good to meet you.
Yeah, nice to meet you too. Thank you for having me.
Okay, you've been listening to UWO Now. Thanks, everyone, for listening. Remember to catch the latest episode of UWO Now. Go to our website, wrst.org, and you can also go to the university's YouTube page to watch today's episode. That's all the time we're going to have. Thanks so much for listening.